Let's talk about the difference between delirium and dementia. Delirium is an acute condition with fluctuating level of consciousness. Dementia is the loss of previously acquired intellectual abilities without the impairment of arousal. But in delirium, there is impairment of arousal, and mostly it's an acute condition. Those are the basic differences. So, onset. Delirium is an acute or sudden onset disease or condition, usually due to another medical conditions. For example, in a female, having an UTI, in a male, having an MI or having a pneumonia, or any other serious medical condition in an older person can lead to delirium. Maybe electrolyte imbalance, maybe a CNS disorder, maybe a stroke, etc. But dementia is a slowly progressive disease, a slow or insidious onset, slowly progressive loss of the intellectual abilities. The duration of delirium is usually very short. Most of the times it's like days up to a week. Within few days or weeks, the medical condition is treated. And when the medical condition improves, the patient's delirium also improves. But dementia is a condition which persists for years. The course of delirium is fluctuating. The patient has altered level of consciousness, and this altered level improves at sometimes, and sometimes it falls back to the previous serious conditions. It fluctuates. That is a very important word for delirium. But dementia does not fluctuate. It's a progressive condition. There is no fluctuation. It's progressively severe loss of mental ability. In patients with delirium, the consciousness and the attention usually decreases. The patient has a decreased or altered level of consciousness. But in dementia, the arousal and the consciousness remain normal. The patient's perception in delirium oftentimes may be abnormal or impaired. But in dementia, the perception is normal. Patients with delirium may have abnormal or variable mood. They may be manic, they may be depressed. And oftentimes, the patients with delirium can have hallucinations, such as visual hallucination, even auditory hallucination. But patients with dementia does not have any hallucination and usually does not have any mood disturbance. So those are the important difference between delirium and dementia.